All right, go back to my PowerPoint. And then Bryn, before I get going, can you just verify again that you can see?
I can. Respite Care Association of Wisconsin is the first slide.
You got it. All right, now I'll lay off the waiting room and turn that over to you, and thank you for that help. All right. First of all, this is very informal. I would encourage everyone to keep yourself on chat, or excuse me, on chat. Keep yourself on mute. You can certainly ask questions in the chat. If they're for me, I can monitor them when I'm done. I believe my colleague Leslie is hopping on in a minute, and she can also manage those questions. Feel free to stop me as I'm speaking and ask a question. I'm definitely going to give my contact information, as well as Bryn will provide her contact information. This PowerPoint that I'm sharing today, as well as Bryn's PowerPoint, will be available on our website under the Webinar Wednesday tab. So there'll be the recording of this presentation, as well as both PowerPoint presentations. So if you would like, sorry, just want to make sure people get in. Bryn, do you have the waiting room?
Yep.
Perfect, thank you. So let's get started. So RCAW's mission is to promote, support, and expand quality statewide respite care across the lifespan. We are funded through the general purpose revenue. We serve all 72 counties and 11 tribes in Wisconsin. We also serve the lifespan. So we serve caregivers who are caring for care recipients, birth through end of life. One of the things we do at RCAW, oftentimes respite care can be planned. However, with caregivers, sometimes it's on emergency-based situations. And essentially what respite care is it gives caregivers the opportunity to rest, refresh, recharge, and temporarily get that break to take care of their own needs. And we can help caregivers get the break, whether it's planned or if it's an emergency situation. And if you've never heard of RCAW, the way I like to describe it is we're twofold. We help caregivers get the break with our grant programs, and we also want to expand the trained pool of respite care providers, and we do so with our free training programs. And we're going to get more into that in just a little bit. Why is respite so important? Essentially, respite care, it's a critical public health intervention. We see caregivers who, and especially post-pandemic, we see caregivers that are having immense mental health crises. They are depressed, they're anxious, they're isolating, and we see my colleague Leslie does all of our intake calls, and the RCW staff is getting trained in crisis calls and responses because we're seeing caregivers call us that are having suicidal ideations. And if they're not taking care of themselves and putting themselves first, that's the point that caregivers get to when it's around the clock. And if someone tries to tell me that family caregivers are not the backbone to the healthcare industry, I would argue till the death of me that they are wrong. Family caregivers absolutely are the healthcare or the backbone to the healthcare industry in our country. In Wisconsin, 580,000 family caregivers, and in the state alone, $7 billion in uncompensated care. And I can't even, it makes me speechless, because you can be standing in a grocery store or somewhere in public, and someone that you see, you have no idea the battle that they're facing because they have a child that's on a trach and completely dependent, or they have a spouse living with dementia that, they get 1 hour a week where they get to run all of their errands, and they're just really going through so incredibly much. And there's so many benefits to respite care. It can really help the caregiver, give them an opportunity to socialize, even if it's with one friend. It doesn't need to be a huge social gathering. It is what you make it. We often like to say respite care is in the eyes of the beholder, but it gives them an opportunity to go for a walk with a friend, to sit and have coffee. They get a chance to relax. They get opportunities to go to support groups and to be around other people like them. When we see prevents bad habits, sometimes the emotional toll it takes on caregivers, sometimes primary caregivers turn to things that aren't healthy to cope. And I'm sure you can fill in the gap. Sometimes it's eating their feelings, sometimes it's alcohol, sometimes it's other things. Now, I'm clearly not saying that everyone does that or every caregiver does that, but with the amount of stress they're under, we do see that happening, and getting a break can prevent that. A lot of times we hear that caregivers feel like they used to have a job and they need to leave their place of employment or decrease their hours. They used to be able to volunteer and do these things, and now I don't like to use the word just, but now they're just so-and-so's caregiver, and they feel like they have no sense of identity anymore. So giving them that break and that chance to do things really promotes that sense of identity. Oftentimes, all the time, I should say, we always hear that respite care is so incredible for the caregiver, and it is. It obviously is, but it's just as important for the care recipient. If a caregiver is completely burnt out and they are completely burnt, and I don't know about you, but when I'm completely exhausted and burnt out and crabby, I'm not my best self and I'm short, and the care recipient can absolutely feel that. So it gives the care recipient a chance to do something like creative engagement and to do fun outings in the community with a respite care provider. Let's see. With our grant programs, which we're going to get into in a little bit, we like to collect as much data as we possibly can. And the biggest challenges that caregivers report they face, so when they receive a grant from us, they do a survey. Number one is they feel completely overwhelmed. And what I think is interesting, the next three things, they all kind of tied: the financial burdens, the lack of socializations, and the lack on other relationships. So if you're a mom and you have a child living with special needs, it's putting a strain on your marriage. It's putting a strain on your relationship with your other children. It's putting a strain on relationships with your other family. They're also living with depression, anxiety, lack of sleep, and physical pain. Oh, there's Annie. We'll let Annie in. Some interesting data that came out that caregivers who receive 4 or more hours of respite care per week had a decrease in self-reported burden over time. So if you think about it, 4 hours a week isn't a ton of time, but that 4-hour period, whether it's 2 hours one day, 2 hours the next, caregivers are able to do what they're doing longer by getting those 4 hours a week in comparison to those who didn't. And I can tell you, since we cover all 72 counties and 11 tribes, we work with a lot of people, and a lot of the caregivers we work with, they're not going on lavish, although we wish they were, they're not going on lavish vacations. They're not doing super glamorous things. They're using their respite hours to go grocery shopping, to go to their own medical appointments, to just sit by themselves and read a book or maybe grab some lunch. So it's really, 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 really important. And I want to show you, and I know it's easy to sit here and preach, oh, it's important to take a break, but I want to show you in just a second how our CAW breaks down those barriers and we try to make it as easy as possible for them to get the break. One of the other things we ask in our survey for those who receive grant funds through our caregiver respite grant program, the CRGP, we ask, what do you do with your time? And the majority of people, they spend time with other family members. They participate in social activities. They had time to relax, rest, participate in hobbies. They spent time with a spouse or partner, or they completed household tasks. All right, so I was talking about barriers a second ago, and these are some of the most common ones that we see and that everyone here on today's webinar sees. Sometimes caregivers don't think they need help. They think, and it depends on the culture. Some culturally, you take care of your family, but oftentimes they don't want to see that they are getting burnt out and they're too proud to accept help. Lack of providers, that's huge, right? There's not a lot of respite care providers out there. Affordability, we saw a few slides back from the data we collect from our surveys. The financial burden of receiving respite care can be huge. And then not trusting others to do the job. Maybe, and I'm not saying this should or shouldn't be, these are just things that we hear. Sometimes people are nervous hiring someone from an agency or someone that they don't know. So now that we talk about these barriers, I want to show you how our CAW breaks them down. To professionals that are on the call, or if you're a caregiver and you might be having a hard time talking your loved one into respite care, reframe how you present it. It's a benefit to the care recipient just as much as it is to the caregiver. The caregivers are getting burnt out, and it gives the care recipient time to do something fun and creative engagement. And it's really important. It really is important. And I don't want to just sit here and preach it like it's easy, because I know it's not easy, but to be proactive versus reactive and to really have a plan in place. Going back to the beginning when I said that we can help people, whether it's planned or emergency, there really are emergent situations that happen. And if there's not a plan in place, it really can make that emergency 10 times worse. And we can help you make that plan. All right, I want to tell you about our free training opportunities. The respite care provider training, it is free. So everything we do at our CAW is free. We don't charge for anything. And the respite care provider training, essentially, this is how we want to help increase the pool of trained respite care providers. I'm going to go to the next slide just for the sake of time. These are the courses. I'll explain the course to you as you can see what courses are in there. So it's free. You can start and stop at your own leisure. Primarily, people who are interested in providing respite care do this. People who have been providing respite care also take this course. So it can be entry level or people who have already been doing it. We have individuals or sole proprietors, people who want to, maybe do their own business, go through this course. We have multiple employers throughout the state who employ providers. Before they can start on the job or on the floor with the caseload, they have to take this course. And we also have family caregivers take it. Once you're done, you get a certificate of 7 hours of completion. We also have family caregivers who want to hire someone to provide respite care for their loved one. Ask that the respite care provider take this course. We hear a lot of success stories with that. One of the things that, we're not the employer of the respite care provider, but we know that to retain good people, they need to be invested in. So if they're caring for older adults and they want to, older adults, specifically those living with dementia, we have partnered with UW Oshkosh, and we do cover the cost of, there's 3 courses. There's dementia generalist for healthcare providers. And once you take that, you can take the dementia generalist class. So essentially what you do, it's on our website. You can fill out the interest form and we then send you the information to get the promo code, and we cover the cost. It's start and stop. It's virtual, work at your own pace. We also have a dementia generalist for friends and family. We don't require family caregivers to take the respite care provider training in order to get that promo code. So if there's any family caregivers or professionals that work with family caregivers that think they would benefit with that by taking the dementia generalist for friends and family, definitely let them know. We also, for anyone who takes the respite care provider training, we can offset the cost of conferences and workshops. And we also are able to provide codes for the online curriculum for life in the community. So essentially it's like 45 different classes, and it's a deep dive into diabetics, autism, different diagnoses, different situations, and you get certificate of completion for those things. And this is all because of federal lifespan respite grant funds that we're able to use those funds for that. We also have online courses for respite care providers. There's information on becoming an independent respite care provider and how to market yourself as a respite care provider. We have the same for caregivers, the same meaning a kit, knowledge, ideas, and tools. Oftentimes the thought of hiring a respite care provider can be very daunting. So we put a course together. It's how to hire, train, and retain a respite care provider. And also caregivers are so exhausted mentally, physically, emotionally. The last thing they want to hear is now take this course. So what we did is we took the meat and potatoes, for a lack of better terms, of this course and put them into 7 PDFs. So they meaning caregivers can go and download those 7 pertinent links into PDFs, just kind of as a grab and go basis. More than welcome to take the course, but if they're too exhausted and just want to grab and go, they're welcome to do that as well. This is what I was just talking about earlier for the dementia generalist friends and family, dementia generalist for healthcare providers, and dementia specialist. I went through all of these courses. They're fantastic. It's not like we check up on you to ensure that you finished them. I would highly recommend requesting some of these promo codes. They're really great. All right, the registry. I am going to go to this page while I talk about the registry. This is an example of a registry profile. So essentially what the registry is, it's a consumer-based site, if you will. You can find it on our webpage or our website rather, and it's a bridge to connect people who need respite care to those who provide respite care. Now, everyone who has gone through not everyone on the registry, I should say, has gone through the respite care provider training. Now, just because someone goes through that course doesn't mean they're automatically put on the registry. They have the option. So they can go on the registry, create a profile. They list their name, their contact information, the ages they're willing to work, the counties that they're available to work in. Then they can list a little bit about themselves. Then it's up to the caregiver. They can search the registry, reach out, interview them in that course that I talked about, how to hire, train, and retain a respite care provider. There's information on how to run a background check. It depends on the person on the registry, whether they are accepting private paid or if they can be paid through Medicaid waiver dollars. So essentially, like I said, it's consumer based. It's up to the person hiring them to do the background check and the interview, but it's a free bridge to connect people who need to those who provide respite to those who need respite. All right, we'll get into our grant programs. So essentially, anyone is eligible for the caregiver respite grant and the supplemental respite grant. There's 4 grant programs I'm going to talk about briefly. However, when I say anyone is eligible, you ask that you try something else first. And friendly reminder, if everyone could just make sure that they're muted, that would help with background sound. I appreciate that. So to be eligible for the caregiver respite grant, you can see the eligibility criteria on the screen, but I'll tell you what the grant is. This I need to update and change. So we recently secured more funding. So this grant allows a primary caregiver to hire someone of their choice. So our CAW has no preference on who you hire, meaning you can hire a friend, a family member, a neighbor, someone from an agency for up to 5 days of respite care. You have to use that respite care within a 30-day period. And as long as you've tried something else first, if you've applied for a long-term care waiver and you're not expecting to receive services, if you've applied and you've been denied, if you're over assets, we just ask that you reach out to the ADRC or the county. We have an online fillable supporting documentation form that just states you've not applied for the long-term care waiver supports because you're not eligible. If some people have applied and let's say you're receiving NFCSP, that's National Family Caregiver Support Program, NFCSP, I'm just gonna do this. There's someone and that's okay, but they're not on mute. Okay. So if someone receives NFCSP, National Family Caregiver Support Program, or AFCSP, the Alzheimer's Family Caregiver Support Program, and they've exhausted those funds, they're eligible to reapply. And people can reapply for these grants every 90 days. It used to be every 100. Well, first it was 90 days, then every county found out about this grant, and our applications, I think, increased. I think it was like 142% from one year to the next. So then we had to say every 180 days, but now we were secured more funding, so you can reapply for this grant every 90 days. The core grant, this is for agencies and organizations, and for any purpose to recruit more respite care providers, outreach events to educate family caregivers. We can provide $3,000 to each county. Let me know. I can definitely meet with you on the side. I just want to make sure that we're giving Bryn enough time to talk. But if you're an agency or an organization and you're interested in hosting an event, let's definitely chat afterwards and we can bounce ideas off each other. I'm happy to share with you what has worked in other counties. The group respite grant, it is exactly what the name is. I'll give you an example of what agencies do with it. There is an organization, the Fox Valley Memory Project. They will have support groups or book groups for people caring for someone living with dementia. A lot of times the barrier for someone to be able to attend something like that is they don't have respite care. They don't have a provider. So what they'll do is they'll hire 3 CNAs, depending on the ratio, they'll hire 3 CNAs to come on site to do creative engagement and meaningful activities with the care recipients, people living with dementia. And so the couples can come and the care partner goes to a support group, book club, has a meal together, and the care recipient goes and does something really fun, and we're able to offset the cost. And caregivers wouldn't be able to attend if it wasn't for that. Now I'm skipping by those because they were very similar to the last slide. They were the eligibility criteria for the supplemental respite grant program. It's the same eligibility criteria for the caregiver respite grant program. However, the allowable expenses are different. So the caregiver respite grant is to hire the human, someone to provide that respite care. And the supplemental respite grant is to hire someone who can help with housekeeping, laundry, meal prep, lawn care, snow removal, if there's technology to decrease isolation, home modifications, transportation, but it has to be transportation to either medical appointments or respite activities. And since we did secure more funding, people are able to apply for the caregiver respite grant program and the supplemental respite grant program at the same time. So you can apply for both, which is really nice. There's our contact information. I'll put it in the chat as soon as I am done with this, and I'm going to pull up Bryn's presentation. Are there any questions in the chat? Oh, thanks, Leslie. Hi, Annie. Glad you could come. All right, now I'm going to pull up Bryn's information, and then Bryn, you just want to verify that you can see it, and I will be more than happy to advance the slides for you.
Perfect. Thank you. I do want to thank everybody who is able to join today. I can see it. Sorry, Rachel. Yes, it's up on this. I know you guys are all busy and this is a lot of information. So I've gone through this presentation a few times, and it's difficult with caregivers who might be joining as well as professional staff. So I'm going to do my very best to make sure that it's applicable to everyone. But certainly if there's questions, please feel free to type them in the chat. If there's an opportunity to answer them, I will. There are a lot of slides. There's 22 of them. However, the last 4 I'm going to breeze through really quick. And some of it too is just eligibility. eligibility criteria, which you do not have to memorize. If you're a caregiver and this is a strong interest to you because you're looking for supports right now, know that I'm ultimately going to point you in the direction of your local ADRC or Aging and Disability Resource Center. And I have links woven throughout the presentation today to really act as a guide and a kind of a takeaway manual, if you will. So as Rachel said, she has a copy of this and she'll be able to share that out following today's presentation. And I encourage you to use it because it is full of a lot of information, and some of it I just will not be able to take a deep dive into. As Rachel mentioned, I should probably introduce myself again. My name is Bryn Ceman, and I'm an Older Americans Act consultant, one of several at GWAR. GWAR is the Greater Wisconsin Agency on Aging Resources. We are one of 3 area on aging agencies in the state of Wisconsin. We support 70 counties and 11 federally recognized tribes. And the other 2 A's in the state of Wisconsin are Dane and Milwaukee County. So sometimes if you, it's just worth knowing that there are different different AAAs within the state of Wisconsin. Next slide, please. As Rachel goes on to the next slide, and actually through the next couple of slides as I continue to talk, I was hoping that maybe you can type in the chat for me a thumbs up, a smiley face, or some sort of affirmation, yes, if you are a caregiver or have been. And hopefully that will make more of the content that I'm going to review today applicable to your situation. It also just helps me know who in the audience I might be able to help. And also, maybe if there's very specific questions or circumstances, my contact information is at the end of today's slide. Certainly always feel free to reach out. Next slide, please. There we go. On the third slide, I thought this was a awesome quote that actually my predecessor had found and made a part of the presentation long before I did. So I can't really take credit, but it really hits the nail on the head. There are 4 kinds of people in this world, said Rosalind Carter. There are those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. So essentially what she's trying to convey, and the purpose of my presentation with all my audience, is that this affects everybody. As Rachel said in the earlier example, it could be the person in the store in the line in front of you. It most certainly could be you, and it could be you several times. So maybe you once cared for your in-law, and now you're caring for your mother. You could be a parent with a child with special needs and also find yourself caring for an aging parent. So most definitely this is a topic that is a national issue and something that I'm happy to really speak on. Next slide, please. If the sentiment of the last slide, the quote, didn't really stir any fire in you, I'm hoping that if you're a data individual and you really like statistics, that this might be a little bit more convincing. So AARP estimates that there are approximately 580,000 family caregivers. Thankfully, Rachel and I had the same statistic on that. And they provide about $7 billion in free services annually. So essentially what this is saying, that this is as large or larger, probably following the pandemic, as our Medicaid system in the state. So $7 billion of unpaid care that is given to individuals who require it. So that's a lot of money, and that in comparison, again, is as much or more than our current Medicaid system. So just having that in the back of your mind to understand exactly how large this is, not just like who it touches in familial aspects or who might be affected as a friend or a neighbor, but economically, the kind of cost that this is to the state and to the nation is immense. Disproportionately, many of the women, or many of the caregivers rather, are women, more than 75% in fact, and new research is showing that even more disproportionately, women of color tend to be caregivers. Next slide, please. I will not review every statistic on this slide, but again, it's good walking away material. This is from the Wisconsin Family and Caregiver Support Alliance, which I'm really honored to be a part of. And there's going to be a statistic in here that jumps out to you or that is shocking. The one that really stood out to me is that there's estimated 28 billion hours of work that's annually lost or interrupted due to caregiving responsibilities. So if we take together the information about who is a caregiver, this is telling me that professionally, women in particular are likely stepping back from promotions or from full-time work or financial stability and securing, their future because they now are taking on roles or tasks of caregiving. I also thought that this slide was helpful just because it really delineates two types of quote unquote caregivers that we talk about in our world of long-term care. There's the professional carer, the person who is hired and maybe does in-home care services or works at an assisted living. And there's the informal or family caregiver or carer. And it's those family caregivers that really is the grant program's main focus of support. There's a whole bunch of work and energy and advocacy that is around our caregiver workforce, definitely, and probably somebody far more eloquent and smarter than I would be able to do a much larger presentation, but that is not the topic of today. It's really how we're supporting our family caregivers. Next slide, please. The next two slides are really just about identifying who is a caregiver. As a professional, one of the largest barriers I think I probably had, and maybe lots of individuals I've worked with have had, is identifying who is a caregiver and who's not. Sometimes you're dealing with the urgent issue as an APS worker or an INA staff, and you're kind of putting fires out. And if you dig a bit deeper, or if you identify what you are tasked to do in your day-to-day world, it helps you kind of ferret out whether or not, in fact, you are a caregiver. So the simple recognition of who you are or who they are and the responsibilities that they're taking on may make a great deal of difference in your world, because that tells you who's eligible for what services and supports and resources. And if you're now identifying yourself as a caregiver, like, yeah, I do these things, I do that. It's good for you to know, even if you don't like the term caregiver, or this is something that was an expectation by other family members or something you enjoy doing, and it doesn't feel like any type of burden to you. That's wonderful and that's great and honorable. That still, though, in our world of long-term care has been coined as the caregiver terminology. So just recognizing that that's who you are, or maybe that's who individuals come to your agency are kind of displaying what they have on their plate as caregiver responsibilities. It helps kind of guide the path for both parties in what can be offered. Next slide, please. I'll go really quickly over this. It's really just asking that if you can say yes to any of the bullet points here or the questions, you are a caregiver. And I think that one thing worth noting is that you don't necessarily need to live with the care recipient to be a caregiver. Many times it's the primary caregiver from afar who's calling to check in, or doing the grocery shopping online to have it delivered, or calling into the pharmacy for the medication to be delivered. They're talking to their loved one at the end of the day to make sure that the doors are locked, to make sure that they're kind of tucked in the house for the rest of the night, that they're ready for bed, and that there's nothing that's really they're bothering them. Or maybe they're just the person that individual is calling frequently throughout the day to make daily decision makings, and that's kind of their cornerstone. Without them, they wouldn't really be successful. So there are situations where a caregiver is not necessarily living with the person, and I just thought it was important to point that out. Next slide, please. Thank you. You'll hear in the coming slides, I'm going to share a lot about the support, the funding, and the services that can be given to caregivers through these 2 grant programs. I'd like to point out, though, what's already happening, because sometimes it can seem overwhelming if we don't already look at what we've accomplished. So we did in the state of Wisconsin have a caregiving task force. And that's one of the green links that is woven throughout this presentation. You can click on it for a full review of the proposal, and below it, I just threw some ideas out there that were proposed. You'll also see that there's other states who've identified solutions on supporting caregivers, working with really competitive employers in their market to help employers identify what a caregiver workforce needs, pushing through legislation for paid family medical care. We do have state recognized family medical leave, but it's not necessarily paid. So there's different types of ideas that states have pushed forward and are really doing a great deal to support their caregiver network. And that too is highlighted in the green hyperlink on the word states. Next slide, please. So here's the meat of my presentation, and it's probably through the next 4 or 5 slides talking about the 2 grant programs. This one is the Alzheimer's Family Caregiver Support Program, or AFCSP, and this is a Wisconsin grant program. It was established in 1985, and this was well before the National Family Caregiver Support Program of 2000. So that puts Wisconsin ahead of the curve, and I think that's a lot to be proud of, and I think that's pretty telling of what we've been able to accomplish as a state. The ultimate goal of AFCSP is helping individuals with dementia to remain living in the community for as long as possible. The grants are distributed to counties based on population size, and the monies are used for goods and services to assist the caregiver, which in turn, as Rachel also pointed out, respite care and other services indirectly support the care recipient. In the couple of slides, I'll describe what supports and services can be authorized or paid for. One noteworthy point, though, that I like to share is that each county who receives this funding, as well as national funding, they do an excellent job of trying to manage the dollars and make them stretch. However, that does mean, though, because it's grant dollars and they aren't infinite, that there might be occasion where if you're a caregiver and you reach out to your ADRC or your aging unit, and they're telling you that there's already a wait list for these grant programs, that may well be the case. Still put your name down, still contact your ADRC, because there are many different services beyond just the grant dollars that can help support you as a caregiver. But I did want to highlight that because I know that's been certainly not in every county or every situation, but that has been the experience. And I don't want you to walk away and say, well, Bryn told me that this could happen. It certainly can. However, it's just a matter of whether or not there's the funding for it. Next slide, please. There's 3 main eligibility requirements of AFCSP. The first is a written diagnosis of irreversible dementia or Alzheimer's by a physician. The second is that the person, the care recipient, needs to have dementia and residing in the community or home setting. And then lastly, that the individual with dementia and the spouse rather, so those 2 combined, can't exceed 48,000 gross annual income. However, something that I've been really trying, and I know many professionals in the network have been trying to do, is really calculate the potential expenses related to an individual's care. So if any in-home support services have been paid for out of pocket, health-related costs, medical mileage, home modifications, out-of-home respite, day service, even nutritional supplements or specific diets for the treatment of conditions or symptoms related to dementia or Alzheimer's, those funds and those costs should be deducted from the gross annual income, and in some cases making them eligible for the AFCSP program. Next slide, please. So this is what it can offer. If you're a caregiver wondering, this sounds great, what will it do for me once I'm found eligible? And essentially, it can offer services much to what Rachel has talked about, the benefits of respite care, having somebody come into your home and care for your loved one, giving you that opportunity to get out of the house, do some errands, or just have time to yourself. The reverse too can happen, where there's out of home respite placement, maybe a day service that can be paid for so that you have some time to yourself at your home to take a nap, to just get things in order, to have time to yourself. There's also many different things, especially with the fact that we have a caregiver worker shortage. Some of the respite that maybe isn't the human respite are things like securing advanced directives, especially if you're early on in your caregiving journey and you just recently have received the diagnosis, or your loved one has received the diagnosis, and you want to get advanced directives or power of attorneys or wills taken care of. Legal expenses can be paid for through the grant. Or if you're worried about the upcoming snow and you live in a rural area and snow removal or other things like lawn care are really weighing on your mind, those are different types of services as well that can be offered. Things that typically are of no cost but of huge benefit are the virtual support or in-person support groups. There's also a evidence-based class, Powerful Tools for Caregivers. And these are just some of the examples that can be offered through AFCSP. Next slide, please. Oh, Brian, you asked a good question. I will get to that hopefully at the end. There's some question about the income requirement for AFCSP. And if I can't speak to it, I'll make sure I respond to Rachel so that it's in writing and you get some more information. NFCSP, here we go. So NFCSP is the National Family Caregiver Support Program, and this is part of the Older Americans Act. So the criteria that I'll talk about in the next slide is the 60 plus category, and that's just as defined by the Older Americans Act. The age of 60 is an older adult. NFCSP is built a lot like AFCSP, and that the services that can be offered are the same. So as I mentioned, all of those in-home, out-of-home respites, home modification, snow removal, really counties and caregivers getting creative. If we can't find human support for respite care, what else could be offered? So there's been some pretty phenomenal use of those funds. I actually like both of these grant programs for the fact that there isn't a quote unquote benefits chart of this is what can be offered and this is what is excluded. There's an opportunity with both of these programs to go through what's called a care needs assessment with the professional at the ADRC and really get to the root and the priority and the urgency of the need of what can be helped now, and really take that burden off of the caregiver so they can go and do their general day-to-day stuff of caregiving with less stress. The people who are eligible are, oh, sorry, maybe to start with, I'll talk about the eligibility requirements, sorry. As far as financial eligibility, for NFCSP, there aren't any, which is very good news. And it's a larger grant too, so that is a great use of the funds to really get to the caregivers who need it the most. I mentioned that there are the age requirements for the care recipients, and that's because of it's part of the Older Americans Act. It was established in the year 2000. So who's appropriate for NFCSP? That would be any caregiver 18 or older who is caring for somebody 60 years of older and is frail. There's also 2 exceptions within NFCSP, which is different from any other part of the Older Americans Act. And that is kind of the waiver between the age requirements. So in NFCSP, we also have some exceptions for family situations to children. So in NFCSP, if you're a grandparent, 55 or older, or other relatives, so this could also include an aunt or an uncle, caring for a child who's under the age of 19, and you're the primary caregiver, you would also be eligible for NFCSP. Same too is the case if you happen to be a parent or a relative caring for somebody with a significant disability. So a good example of this is parents who are parents who are raising their child with a developmental or intellectual disability, who's now grown into a young adult, so they're over the age of 19, but parents still act as the primary caregiver. And FCSP is an opportunity to support some of the funding and the care and services for that child or young adult in this situation. I've seen that most commonly used if there's wait list or difficulty getting, well, there aren't wait lists for long-term care, but if there's difficulty getting into a long-term care program like Family Care or Iris, and there needs to be some short-term supports in place, or other types of crisis situations before a more long-term plan can be made, and FCSP dollars are good to be used in those types of situations. The other exclusion to an FCSP is that if the caregiver is 18 or older and the person that they're caring for has a diagnosis of early onset dementia. So it doesn't happen to, well, I shouldn't say that. It can certainly happen. Hopefully you don't see somebody with a dementia or Alzheimer's diagnosis at the age of 40 or 50, but should they have a written diagnosis, that caregiver would then be eligible for NFCSP. Next slide, please. I really talked a lot about this one as far as what can be covered. It's much the same as AFCSP. It can be the respite care, in-home, out-of-home. It can be really individualized to what that caregiver needs. Maybe it's assistance with the snow removal or yard work, medical transportation, home modifications, and more. Next slide, please. As I mentioned, all roads are going to lead you back to the EDRC. I'm newer to my role myself. I've only been about 9 months into this position. And as much as I think I know, and as many questions as I get from caregivers themselves, and I want to help, I still even need to rely on local EDRCs because, of course, GWAR isn't managing the caregiver dollars. It's at your local EDRC. So in many cases, I can provide education and information, but to really enroll in the program and access those dollars, please contact your local ADRC. This is another slide where there's those green links. The first one is to your local ADRC. You can punch in your zip code and it'll show your local ADRC and where to contact them. And then the second link is a state ADRC brochure that's available in other languages. Next slide, please.
Sorry about the interruption. I just wanted to get someone muted. The background noise was pretty loud.
No, that's fine.
All right.
So this slide is about being a caregiver and really taking care of yourself. I think it goes without saying, and this is ultimately why the grants exist. This is the classic situation of putting your own oxygen mask on first, if you will, before assisting others. If you become disconnected and become isolated, you don't have a network of support to lean on. And our best advice and what we've seen the most helpful with are keeping lists of what you could very specifically need help with. Maybe it's grocery shopping, maybe it's that snow removal. For some reason, it must have been a lot of emails I've gotten recently. It's the third or fourth time I mentioned it, but people are anticipating the coming of winter and being prepared. Maybe it's just laundry help because your washer and dryer are on a different level and you know that the bedding that now is going to need to be changed more frequently isn't something that you're going to be able to manage a task of. So being very specific on what you can use help with is good, because then when somebody does take you up on that, hey, can I help? And you say yes, you can be very specific on what to ask for. And sometimes too, it really comes at a good time to match up a person's talent and skill set with the need that you have. So if they're a handyman and that really is a need that you have as a caregiver, it feels better for them to not only be helping you, but to be helping you in an area that they feel that they're skilled in. Same thing for somebody who enjoys cooking. Bringing over a couple of meals a week is easier than for somebody like me, for example, who isn't a great cook. That would be a pretty big ask. But those are just examples. And I think that the keeping yourself well not only ultimately saves you a lot of stress because there isn't any worry about what happens to the care recipient or my loved one if I'm not here to do it. It keeps you out of the hospital. It prevents the falls. It keeps you connected. It keeps you emotionally and mindfully and spiritually well. And the better you are, the better you can care for your loved one. Next slide, please. I am nearing the end and hopefully I'll have a few minutes for questions. So these are additional resources. I'm actually not going to go through this. There's a lot of really good information, so please use those links, especially if you're a caregiver. So much useful stuff. It actually even helped me in my own professional training as I got comfortable in my role. So I would highly recommend them. The next two slides as well, Rachel, you can advance. Trualta is a free e-learning platform, and you can be a caregiver who's a part of AFCSP and NFCSP or not, and still enroll in Trualta. It's usually 5 to 7 minutes of an easy read or a quick audio listen where you can get information specific to what you might be desiring at that time. So it talks about caregiver self-help. It talks about personal cares, if you need assistance and advice on how to do grooming for your loved one or your care recipient. There's modules on that. Also, Tipa Snow, for those who are familiar with her, she has designed teaching videos specific for the Trualta site. So those have really have rave reviews from caregivers who've watched those and benefited greatly. You can go on to the next slide. And the next slide too. These are apps. I have not checked them all out, but I've used actually myself a couple of them. And they're resources that, again, if you are a caregiver, they can be designed to meet your needs and your circumstance. And some too have an offer of an enhanced service where you can pay additional. But otherwise, a free service to initially download the app and get started may help with especially if you're a family network of caregiver support and you're maybe working with a brother in a different state or even a different county. It's a good communication tool about medical updates that some can provide or coordinating who's visiting the care recipient on a given day. Next slide. We'll cruise through that one too. Again, good information, but I will let you guys tackle those on your own. This is really the rewards of caregiving. Oftentimes I find I do presentations or talks, and even just in general, as I'm doing my own learning and sitting in on trainings and webinar, caregiving can seem like such a stressful time and, you know, an overburdened time, but it's also a special time. Caregivers tend to be in this role because they want to be. They feel it's an honor. It's an opportunity to care for a loved one. And many times it's the opportunity to build new memories, have a special experience, maybe start a new hobby, explore genealogy or family history. Maybe it's also this time where you get to plan for the future and talk about things to come, which is a huge blessing. So I just kind of wanted to pause and take a moment and say that caregiving is not always stressful, is not always overwhelming. There are many benefits, and the caregiver typically wants to be in that situation. They just really need the help to be the best that they can be in that situation. The last two slides here, you can go ahead and advance. One is just about a advocacy opportunity. So we have some pretty amazing advocates, a part of grant work that we do at GWAR. And they certainly find their rewards in caregiving in an almost giving back type of manner. So if you happen to be somebody who's a former or current caregiver and are curious about advocacy work around this issue, please contact me. That's on the next and last slide, my contact information. And I can definitely give you a lot more details, but you are welcome to join that grant funded project. We always welcome new people, and there's some really good energy and work going on. So again, thank you. I realize that I took up the entire 30 minutes, but I hope it was valuable and worth your time. And I see that there are a couple of questions, so I'm going to try and tackle it.
So Brian said, hi Bryn, any words, thoughts on an increase to that 48,000, as it doesn't take too much any longer to get to that with 2 retirees as a couple. It seems an increase could help more folks. Thanks.
I couldn't agree more. And frankly, it would help us as a state to spend all of the AFCSP dollars. There's nothing more frustrating from a professional lens to have access to those monies, but you can't get it to the people you feel need it because of some sort of criteria. So yes, the short answer is it's been talked about. I have heard rumblings. There is nothing definitive though. And I think that that's where that advocacy piece comes in. If we're able to share either as a professional capacity or on a personal level, I'm a caregiver, I went to the ADRC, I'm told I make too much, how can that be? Especially if dollars go unspent. Legislator, representative, how can we change this? Those are those opportunities to really make some impact. But as it stands right now, 48 gross as a spouse, as a couple, is the criteria threshold.
And then Emily from Outagamie County said, please remember that each ADRC, depending on the county you live in, provides different services for AFCSP, NFCSP. It may vary. And she just wanted to let everyone know that it's county specific. And Bryn, I do have that question because it's when we're working with different counties, some counties, they make it harder for caregivers, not calling any counties out, but when they're contracted with specific agencies and there doesn't seem to be, how does that work, or how are counties able to do that when a caregiver is utilizing those funds, but they can only utilize them with certain agencies? Is that pretty common?
I would say about half so far in my experience. And here's the why behind that. So okay. NFCSP and AFCSP actually don't have too many parameters. What they do in counties, for good reason, is they set up their own county policy on why certain amounts can't be paid, or maybe because there's tax implications, or maybe they use vendors that they're only contracted with. Or they may set their own dollar amount. So NFCSP has annually $4,000 spend as a cap, but some counties may put it at 2 or 3, and that's to kind of stretch the dollars. Okay. So unintentionally, I think that sometimes it can be made hard. I do think that there's been a lot of really creative, successful ways folks have kind of tackled the tax issue if they're paying a primary caregiver a non-professional stipend. Some agencies, especially now with the workforce the way it is, have hired many caregivers. Or if they become, a registered respite care worker, that gives them the opportunity to not only be a caregiver for their family, but for many people. So I think the more that we're having to be creative, counties are doing a really good job of finding ways to either support the individual in a different way if it isn't the person respite. They're doing different ways to find that in-person respite, but going about it in a different manner.
Good. Happy to hear that. And Anne asked, does the government do anything for dementia caregivers or deductions? Anne, do you want to expand on that a little bit?
Yeah. Okay. I guess what I'm trying to say is, when we're paying out of pocket ourselves to have someone come in to give us some respite time, or if we have appointments and say I'm paying my sister-in-law or someone to come in, that type of thing really adds up over the year. And I'm wondering if there's anything that the government does for caregivers or for the person themselves as far as a deduction for that. That makes sense.
That's a great question. To my knowledge, no. The best advice I would give if I were a professional and you came to me in that capacity is just based on my own experience. If you have healthcare expenses, caregiver expenses, make sure you're talking with a CPA, somebody who is knowledgeable in that area, because if you are paying for medical costs out of pocket, there might be the opportunity in a way of taxes. But there isn't any, kind of caregiver tax credit right now. There isn't any specific to dementia or otherwise.
Okay, thank you.
And I agree. I don't have any magical answer, and I think a CPA would be the best place to go. Well, with that being said, thank you so much, everyone, for coming. To the professionals, thank you so much for everything you do to help caregivers. Caregivers, thank you so much. You do, being the backbone of the healthcare industry. And by the end of the day tomorrow, the recording to this session, as well as Bryn's PowerPoint presentation, will be on our webpage. Thank you so much, everyone. And Bryn, thank you so much for coming and sharing your expertise.
Thank you.
Have a great day, everyone. Bye.